I'm Jennifer Bjorklund, and this is Ask the Doctor, a Lifescript Cedars-Sinai Women's Health Report. Skin cancer is on the rise, particularly in young women. The disease has increased 8-fold among women under 40, and anyone can get melanoma, regardless of family history. Anyone. So pay attention to those lumps, bumps, and moles, because it could save your life. Lifescript's Mari Cartel has the story.
34-year-old Peyton Stone was a sun worshiper for most of her life.
We were at the pool every single day, and we were at Florida for 2 weeks every summer, just basking in the sun. And I literally did not wear sunscreen till probably I was in college.
Then she noticed a few odd moles on her body. Her dermatologist, Dr. Joyce Fox, Cedars-Sinai Medical Group, found several dysplastic nevi, a precursor to the deadliest skin cancer, melanoma.
Dysplastic nevi are moles that look a little funny. Unfortunately for Peyton, they are a harbinger of possible melanoma in the future. So she comes very regularly for physical exams of her skin.
And like many women who've baked in the sun, Peyton had more bad moles that she couldn't see.
I only came in for the ones that I could see, such as on my chest, and I had a couple on my stomach. She then found quite a few on my shoulders and back that I did not know were there.
Skin cancer runs in Peyton's family. Her mom had basal cell carcinoma, and her dad was treated for melanoma. That family history plus her complexion puts Peyton at a higher risk for the disease.
She had fair skin, light eyes, blonde, a history of much sun exposure, as well as a family history of melanoma and some funny looking moles. At that time, I also, on the examination, found a little basal cell on her shoulder, and she was quite young. So that is a risk factor for watching her for the rest of her life for skin cancer development and melanoma.
Now Peyton is serious about protecting her skin and sees Dr. Fox regularly.
I used to wear 4 all over my body and think that that was sunscreen, and 8 on my chest and face. And I have now upped it to where it actually, I'm not getting much color at all. Most of my tan is from a self-tanner that I do use. I never thought my dad would be diagnosed with melanoma, ever. I never even thought it was a big deal until really that happened, and it was scary and it was real, and now I'm here every 6 months making sure I don't have that.
From Cedars-Sinai Medical Group in Los Angeles, I'm Mari Cartel.
Thank you, Mari. Now we're joined by Dr. Joyce Fox, Department Head, Department of Dermatology, Cedars-Sinai Medical Group. Dr. Fox has advice for women on how to decrease our risk of melanoma and what new treatments are available if you're diagnosed with the disease. Hi, Dr. Fox.
Hi, Jennifer.
So SPF 50, 100, we hear that it doesn't matter. Is that true?
Yes, it's true. SPF 30 or higher is what's indicated now. The new guidelines came out, and we just have to look for broad spectrum on the box and make sure that it's water resistant for up to whatever time it says.
What other precautions can people take to prevent skin cancer?
Well, the sun is what we know causes skin cancer. There may be other factors like genetic disposition, but for sun protection, clothing is important. Broad hats, broad-brimmed hats, a lot of long-sleeve clothes that are tight-weaved, as well as sunglasses to protect your eyes, and the sunscreen reapplication every 2 hours is very important.
If you have a lot of sun damage, say you have freckles, you have obvious sun damage on your skin, what can you do to prevent skin cancer besides just watch and wait?
The 3 critical factors are avoiding sunlight now with protection, clothing, sunscreen, avoiding reflecting surfaces that are light and being out in the sun from 10 to 2. Using your skills to examine yourself that you can get through a doctor or through the Academy of Dermatology website about what to look for on your body, so self-examinations. And the third is regular full body skin examinations with a dermatologist to check for even areas that you can't examine on your own body.
When we think of skin cancer, you assume it's someone with light skin is the most susceptible, but anybody really is, right?
Absolutely, yes. We have patients Mexican Americans are a darker skin tone that do have skin cancers, both melanoma and the non-melanoma skin cancers. And the African Americans need to especially be cautious of the bottom of the feet and their backs where they can't see, because those are diagnosed late because they're not visualized by the patient.
And it's probably not on their radar. It's not something that they're thinking about because they're not in that high risk group as far as skin tone.
Right. Lately, people have become aware, thanks to the media, and they are coming in for skin checks as well as Caucasians.
What are some of the warning signs of skin cancer that we don't think about, and do women often ignore them or don't know about them?
Well, we ask people to do their self-examinations, including we're teaching the beauticians now, the cosmetologists, to go through the scalp when they're doing their hair to look for these diagnostic signs of any non-healing sore, an open sore, a bump that might bleed, a dark mole or a white mole that is changing with time if the client tells them that, or if the patient sees that on their skin. So those are the criteria for melanoma, squamous cell, cancer cells, anywhere.
So it's kind of all hands on deck when it comes to...
Yes, we all need to be involved. Sure.
What are some of the new treatments for melanoma? If you're diagnosed with skin cancer, what can you expect?
Well, for skin cancer per se, the regular basal cells and squamous cells are a surgical problem. They rarely go internally. For melanoma, it would be surgical for the first level, which is a superficial melanoma, with an excellent cure rate of 95%. But for the third stage, the metastatic stage, where other organs are involved, then they do have new cancer treatments that are chemotherapy or biologics. And they're figuring out now how to combine them to get the best result other than the usual 20% survival rate. Not good.
Yeah. Thank you so much, Dr. Fox, for talking to us today.
My pleasure.
And it is good to know there are ways to prevent melanoma and that there are new options for treatment. If you want information about melanoma, visit our Skin Cancer Center at lifescript.com or Cedars-Sinai at cedars-sinai.edu. This has been Ask the Doctor, a Lifescript Cedars-Sinai Women's Health Report. I'm Jennifer Bjorklund.